Welcome to Double Kidney. If you are new here, my name is Catherine and I've been working with kidney disease patients for almost 10 years now. And if there is one thing that can make all the difference between ending up in dialysis and reversing kidney disease, it's proteinuria levels. Proteinuria levels can actually tell your future. Fact: having unusually high levels of protein in the urine means your kidney function is going to get worse fast. And while for those without diagnosed kidney disease, seeing a foam in the urine means that their kidneys are actually being damaged, the best nephrologists actually use proteinuria levels to reliably predict if a CKD patient will have kidney failure in the near future. Yes, this level here is even more important than GFR or creatinine when looking at your analysis. So next time you get tested for kidney function, pay special attention to your ACR and your proteinuria levels, no matter what stage of CKD you may be in. And guys, there are powerful natural remedies, medications, and good habits to lower proteinuria levels fast and avoid dialysis. Actually, I want to start by showing you some foods that you should eat more often if you want to fight proteinuria and improve kidney health. Number 5, eat more often walnuts. Oh, I love walnuts. This tasty snack is so rich in antioxidants that it may even help prevent heart disease and cancer. Also, there are studies confirming that diets enriched with walnuts led to lower cholesterol when compared with other diets. And this is really important if you have kidney disease, because taking care of your heart means taking care of your kidneys. And while you may get this health benefit from other nuts too, walnuts are the nut with the greatest omega-3 fatty acids content. And also consider flax seeds. This is a superfood with powerful anti-inflammatory benefits. According to studies, flaxseed can actually improve kidney function in those suffering from inflammatory kidney disease. But everyone should consume flax seeds. Just like walnuts, this is a great source of omega-3 fatty acids. And omega-3 fatty acids are key to fight proteinuria and avoid dialysis. And maybe the best vegetable source of omega-3s is chia seeds. The chia seed is a tiny little powerhouse that can add a lot of benefits to your diet. Eating these seeds regularly may actually help improving your heart health, lower your blood sugar levels, and protect your kidneys from proteinuria. Now, what makes chia seeds one of the healthiest foods you can eat is their omega-3 fatty acids content. This benefit alone is worth including them in your renal diet. Yes, all these foods are very rich in omega-3 fatty acids. That's why they can protect your kidneys from proteinuria. And adding more omega-3s is really good for your kidneys. Actually, the whole premise of today's video is that lowering your proteinuria levels, or ACR, will significantly slow down the progression of kidney disease. And it brings us closer to our ultimate goal, avoiding dialysis. And guys, this is actually amazing! However, you should know that while the foods I've shown you are very healthy and they have proven benefits, patients in these studies actually needed to also supplement omega-3s. So you will actually need a higher dose of omega-3s than what you may get from foods to achieve the result. I've shared the best dosages and all you need to know about omega-3s in my video up here if you want to know more. But don't go away yet. Our next remedy is a vitamin that's actually proven to help you slow down kidney disease and decrease proteinuria levels almost immediately. This is a very cheap, easy to find supplement that can actually save the life of people with kidney disease. Before I show you what it is, there is one easy tip to greatly lower proteinuria and protect your kidneys you should absolutely know about. Very important tip! If you take a blood pressure lowering medication, Be very careful with the medication you are taking. There is a lot of buzz surrounding blood pressure medications these days, and patients should be extremely cautious and double check what their doctors are prescribing them. This is what medical newspapers recently headlined. Common hypertension drugs can cause kidney damage. Are you affected? This is the headline on The Express, a major British newspaper. A recent study found out that people taking a certain blood pressure medication are actually damaging their kidneys instead of protecting them. Yes, you hear this correctly. I've been saying this for years and now I'll repeat it. If you want to be safe from a potentially lethal medical error, you need to double check everything your doctor prescribed you. This is why getting informed about your health, like you are doing right now, is one of the best things you can do. So watch my video up here if you have missed it, so I can show you exactly which medication is now linked to kidney damage. And also consider that not all the blood pressure medications are going to protect your kidneys from proteinuria. Some will do this and some won't. Beta blockers, for example, are not a good first-line medication for high blood pressure in those with proteinuria, and yet they are often prescribed. On the other hand, if you get your doctor to prescribe you angiotensin receptor blockers, or ARBs in short, this medication will actively protect your kidneys from proteinuria. Because while all blood pressure medications work to lower blood pressure, are the most powerful type of medications when it comes to protecting the kidneys. So be very careful with the blood pressure medication you take if you have proteinuria. Time now to see a vitamin that is actually proven to help. Researchers have recently discovered that there's a vitamin that can significantly reduce the severity of proteinuria among patients with CKD. Actually, every single kidney disease patient should be supplementing this one. Deficiencies are extremely common when it comes to number 3, vitamin D. Vitamin D really is the kidney vitamin. Low vitamin D levels have been linked to fatigue, frequent infections, bone pain, a dozen other nasty symptoms, and a faster declining kidney function. And getting vitamin D levels back to normal can help fight diabetes, lower blood pressure, and also protects the kidneys from proteinuria. This is extremely important because, as we have seen, means the risk for dialysis is now lower. But wait a moment before starting to take vitamin D3. There is a hidden risk connected to this vitamin very few people know about. Because while taking vitamin D3 in the recommended dose of 25 micrograms per day works for some, unfortunately, some others may have vitamin D deficiency even when they supplement it. What to do then? Don't forget to get checked for vitamin D levels even if you're already supplementing it. Because keeping the levels of this vitamin in the correct range is not always easy, but it is crucial for your health. And watch this video up here so I can show you exactly what to do to avoid this hidden danger of vitamin D. So guys, supplementing vitamin D really is crucial for good kidney health and proteinuria levels. Time to see our number 1 now. And guys, the good news is that our number 1 for today can seriously help you lower this crucial level. This is an incredible remedy with powerful documented benefits. According to a study published on a respectable peer-reviewed journal, taking this natural remedy for 3 months is enough to obtain a reduction of 36.7% in protein in the urine, or albuminuria. Guys, before I show you what it is, there is one thing we absolutely need to clear here. As I was saying, your doctor may use ACR or urine albumin to creatinine ratio to predict the health of your kidneys in the future. But wouldn't it be even better if we could do this prediction by ourselves? Let's see how this works. How to read your ACR levels. Also known as albuminuria or proteinuria, this is one of the most important markers of kidney damage. It's usually indicated on your blood analysis as ACR, but you could also find albuminuria. This level is just as important for those with CKD as for those who are at risk for CKD, maybe because they have diabetes or high blood pressure. This table here explains it pretty well. What it tells us is that the lower the albuminuria, the lower the chances of progressing to a worse stage of kidney disease. And this is always true, no matter what stage of kidney disease you are in. So if this level is below 30 milligrams per gram, you're more likely in the green. Your kidneys are going to be stable in your current situation. If this level is between 30 and 299 milligrams per gram, you are risking that your kidney disease will worsen. In this case, you are in the orange or red, depending on the stage. Now, when this level is over 300 milligrams per gram, being in the red is a reason for concern. In short, keep albuminuria or ACR under 30 milligrams per gram in all the stages of CKD to slow down CKD. Time to see our number one now. The incredible remedy that can save your kidneys from proteinuria is number one, cordyceps. This little fungus you see here is one of the most powerful remedies on earth when it comes to kidney health, according to science. In a review of 22 studies on cordyceps, almost 1,000 CKD patients were found to have significantly lowered their creatinine levels, improved many other markers of kidney health, including hemoglobin and serum albumin levels. This basically means an all-around improvement in kidney health and kidney function. And as we have seen, they reduce their proteinuria or ACR levels by more than a third in just 3 months. Incredible! Now guys, what you should know about cordyceps is that this is not your usual herbal remedy. This is actually a parasitic fungus that actually turns ants into zombies to grow. And while taking it as a remedy is pretty safe, there are some precautions you should know about. I've explained all you need to know to use this remedy in my video up here. And this is all for today. Thank you for watching.